Hi, this is Pamela Sirkman, and this is my Complete Health Physical. Hi, Maggie. My name is Pamela, and I'm going to be the nurse taking care of you today. Can you tell me why you're here?
Just wanting to establish a new physician.
Okay. So along with that, we're going to be doing a whole baseline assessment of you, of all your physical systems. I'm going to be doing some various things and asking to be in your personal space a little bit. Is that okay?
Yep.
All right. And I'll just keep you updated as we go as to what I'm going to be doing. There won't be any surprises or anything like that. But this is important to get kind of a baseline that we have down. So as you continue to get your care here, we can work with you. So Maggie is 21 years old. She appears her stated age. She is good personal hygiene. There's no obvious deformities or issues with that. This is just with my first impression look with her. She is alert and oriented. She has appropriate responses. Her facial expressions, there's good eye contact. She's able to articulate appropriately. Her, like I said, her personal hygiene is good. Her nutritional status looks adequate. Another reason that we're going to be doing this physical assessment and health assessment is to help Maggie establish some health goals for herself and to find out what we as a healthcare provider can do to help her achieve those goals. Okay, just stand up here. Is that touching the top of your head good? Okay, you can step away.
5 feet and 1 inch.
Okay. And then, are you okay with me weighing you? Okay, I'm going to be taking Maggie's vital signs. I do have an automatic blood pressure cuff taking her blood pressure. And I'm just going to count your heartbeat here. Okay, her heart rate is 90. Her blood pressure is 108/60. Temperature goes across your forehead and behind your ear. 97. And while I checked her pulse, I was also checking her respirations were at 16. All right, Maggie, I'm going to begin my assessment, and I'm going to start with just you holding your hands out. And I'm just looking at your nails. Your nails look smooth and rounded. I don't see any problems or brittleness or anything with your hands. Her skin color is pink, warm, and dry. She has good color. Looks like she's, healthy skin tone. Do you have any bumps or anything like that on your head? Look straight at me, and I want you to raise your eyebrows. Okay, let them down. Smile, frown, puff your cheeks out, okay, and show your teeth. Okay, so I'm testing cranial nerve 7, which all seems to be intact. There were no deformities, lesions, bumps, bruises. Her hygiene is appropriate. We're going to be testing, I'm going to be touching your face here, and I just want you to clench down, clench your teeth. There you go. Okay, Good. Good equal muscular tension going on there for the transmandibular. Any problems with sinus pain? Any tenderness when I touch? All right, very good. Next, I'm going to be checking for the cranial nerve 2, 3, 4, and 6, as well as checking some of Maggie's visual fields. So first, I just want you to look straight ahead, look up, look down, look to the left. Keep your face straight, please, like your head straight, and just move your eyes. Good. All right. I want you to look straight ahead and tell me when you see my finger wiggle into your view. Okay, that's appropriate peripheral vision. How about coming up from the bottom? Okay. Good. Let me know again when you see it come into your vision. Okay. Maggie has no tinting in her the whites of her eyes. If I look down, her conjunctiva is pink. There's no paleness, signs of infection, or anything like that. I can see that she is wearing contacts. We do not have access to the Snellen eye chart. However, if we did, we would do a vision acuity test at this time, doing the right eye, the left eye, preferably without her glasses or corrective lenses, and then one with. So Maggie, I'm going to be kind of coming close into your space here a little bit. I'm going to have you look straight ahead. I'm going to shine a light into your eye. Great. And I'm going to just keep coming forward a little bit. Sorry to get so close. And I do see the red reflex in her eye. And there it is again. With this, I don't see any clouding, any blockages, any floaters. Do you have any visual disturbances, any problems with visual disturbances, floaters, blurred vision? All right. All right, Maggie, I'm going to be checking out your ears. Do you have any problems with your hearing? Do you have any ringing in your ears or anything like that? All right. Any problems with frequent ear infections? How about as a child? Did you ever have tubes in your ears?
Lizzie did.
No, you did.
I did not. I did not have tubes in my ears. Elizabeth had ear infections and she had tubes in her ears.
Okay.
So that's why I said I didn't. I had ear infections once or twice.
Okay. So I'm going to inspect the outer ear here. It looks normal, healthy. There's no infections. I'm going to, in order to look in her ear, I'm going to bring her ear up and pull it towards the back and insert the otoscope. And I can see your eardrum, and it looks fine. There's no bulging. Piercings noted. And good. I can see her eardrum there. No wax buildup, no signs of infection or damage, redness, irritation, or anything like that. Next, I'm going to be checking your neck. Okay, and some of the features in your neck. So I'm going to come down and check for any lymph node enlargement. Do you have any pain when I touch you? The lymph nodes extend down this way. You can feel kind of all back in here, even in the axilla region if you needed to, but there's no lymph node swelling here. I'm going to feel for any other kind of deformities or anything like that, which I don't feel. Can you open your mouth? Just show me your teeth again. And can you take your little partial out? Okay, now show your teeth. Open up. Say ah. I do see her tonsils are present. They are a little bit enlarged, but not red or swollen. Any frequent sore throat history? When she says ah, I do see a lift of the small palate. And the uvula appears midline and reactive to when she speaks. Any problems? Show me your teeth again. Open up. No, just stick your tongue in. Open up and say like ah.
Ah.
And I don't see any problems that would need like dental referral or anything like that. I'm going to be checking some of your cranial nerve 11 is what I'm going to be checking next. So I'm going to be touching your face, and I want you to resist against my hand. I'm going to try to push your your face one way. Good. And now do the same on that side. Good. And now try to push up against my hands, and both of those are strong and equal in strength. All right, we're going to be taking a look at some of the thoracic cavity here. I can see, feel for Maggie's spine. I don't feel any tenderness when I do this, Maggie. The spine, lean forward a little bit, like a hunch your back, hunch like a cat. No, the spine is midline. There's no deviation of any kind. I don't feel any masses or deformities on her back at all. You can sit up straight. First of all, I'm going to take a listen. Take a big deep breath in and out. Again. Good. One more. Good. I want you to repeat the phrase 99.
99.
Again.
99. 99. 99. 99.
All right. And I do feel equal what is the word? Resonance in each of the lung fields, bilateral resonance when she does that. Lung sounds are clear. There's no crackling. There's no wheezes. So everything looks good in the back here and the back of the neck. While you're back there, I'm going to feel a little bit more for the lymph nodes. I'm going to assess her trachea is midline, and I'm going to just check here for thyroid. Feels even and smooth. The edges are smooth. It does not feel enlarged. I don't feel any problems with that. All right, Maggie, thank you for laying down. I noticed that Maggie, her breasts are symmetrical. There's no abnormalities reported, any deformities, there's no discharge. We did discuss doing self-breast exam. And we discussed going two fingers in a circular motion, starting at the outside here, going around each breast, and moving in as she completes each circle. I'm just going to have you lift your arm up here. I'm just going to feel down here for some lymph nodes. Good. I want you just to breathe normally. I'm going to listen to your heart. And I do not hear any murmurs or any gallops or anything like that that would be unusual. All right, so abdomen, if I was looking at her from the side, her abdomen would be considered flat. I'm going to take a listen first. We always listen before we do any palpating. And just breathe normally. I'm just going to be listening to your stomach. Do you have any tenderness when I touch? Have you had any abdominal surgeries?
No.
Can I have you take a deep breath in? Okay. I don't think I'm able to actually palpate her liver I don't feel the spleen at all. I don't feel any masses, abnormalities, or anything like that. Bowel sounds were normal, active in all 4 quads. With Maggie in this position, I'm also going to be checking for a femoral pulse. I notice that her legs are symmetrical. Checking for a pedal pulse. Dorsal tibial. Very strong. I don't see any edema, any swelling, any deformity, any kind of issues with range of motion so far with the exam. Okay, we're going to move on to check some neurological things with Maggie here. So I have a paper clip. I have it pulled up so there's kind of a sharp end and a dull end. So if you could just put your legs down in front of you, close your eyes, and just tell me if you feel the sharp end or the dull end.
Sharp.
What about that side?
Dull.
Keep your eyes closed.
Sharp. Sharp. I can't tell.
Okay. Close your eyes.
Sharp. Sharp. Dull. Thank you.
How about down here on your feet?
Sharp. Dull.
Okay. Very good. Can you extend your arms out and with your right hand touch your nose? Look forward and bring your arm back. And now do your left arm. Okay. And now can you put your, stop. Can you put your heel on your shin down here on the lower and just pull it up on your shin? Like now, pull your heel. No, 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 no. You want to slide your heel up your shin. There you go. Can you do it with the other leg? Okay. All right, Maggie, I was wondering if you can go up on your toes for me. Up on your heels. Do you have, when I've watched her walk in, her gait is steady and normal. There's no limping. I'm going to do something called the Romberg test that tests your equilibrium and balance. So I'm going to touch you lightly. I want you to close your eyes. Very good. Have you do some range of motion things. So I want you to bring your arms up. Bring them up this way. Bring them down. All the way down. Okay, how far back can you reach? Bring them up this way. Good. How about your neck? Can you bend your neck forward and up, side to side? Look side to side. All right, your waist. Can you bend back, forward? You touch your toes? Good. Can you do a shallow knee bend? Good. Any pain in any of those areas?